we've been training a lot of physicians. Our goal is to train as many physicians as we can in fetal alcohol spectrum disorders. We train residents, and we train medical students, nursing students, and other health-related students, social workers, psychologists. Our center, has trained 5,200 trainees in the past 3 years. A lot of docs out there ignore the FAS and FASD and think it doesn't exist because they don't see it and not educated about it. Well, fortunately, that the majority of physicians do not advise any drinking during pregnancy. And I think it's changing through time, as I note that the older physicians mostly still occasionally are more lenient about this. Women and the younger physicians of both sexes are not, and are absolutely saying zero tolerance, basically. Our bodies are different. Some of us may not tolerate a drink and may have the side effect in a baby the same that you may have with 3 drinks. And then who said if you take 1 drink, you're going to stick with 1 drink? You may take 3 drinks and call it 1 drink. But what do you call 2 glasses of wine? Is it 4 ounces, 5 ounces? What if you filled your glass with 10 ounces? This is 2 drinks already. So it is dangerous. Usual beer is 12 ounce, right? You buy this big beer and you call it, I had a beer. Well, that's 2 beers, that's 2 drinks. It varies out there, and varies by packaging, varies by liquor, varies by type of drink. An example I always like to give is like you can smoke 2 packs a day for 30 years. You may get cancer, you may not. But do you know if you're going to get cancer? Your chances are going to be much more, but not everybody gets cancer. So it's the same thing. Who knows if it's 1 drink or 2 drinks or 3 drinks? Some may get it, some may not. Are you willing to treat this as a Russian roulette and with the baby? I'm not. Let's say with autism, sometimes you don't know the reason and it's common and what have you. This is preventable. We know the cause is not drinking. So it's the most common preventable disability. With that, the excitement should be much more because you can do something about it. With comparable other disabilities, prevention is not possible and treatment is as difficult as FASD. So it really makes you feel good if you can prevent even 1 case. Now remember, 50% of the population in this country drinks, right? And 50% of the pregnancies are usually unplanned. So you're going to get hit with social drinking without knowing it. That's why, the planning should start when you plan pregnancy, not when you get pregnant. There is a lot of focus also now by our centers to do screening and brief intervention of alcohol intake and other drugs, and not only in the childbearing age. It's kind of treated as a universal problem like smoking. It should be like weighing you or taking your blood pressure. It is as important as that because it may be people hide it, right? I mean, they may not tell you on their own. And when you put it in a format of structured for everybody, you'll get better yield in identifying the at-risk drinkers and treating them in the office or referring them. Behavioral change of physicians, both at the practice side so that they can do it, as well the acceptance of many of them doing it. And that's a big hurdle, especially alcohol, not illegal drugs. It's a legal social norm. Why should we be looking for it? Well, if you're pregnant or planning pregnancy, don't drink. If you're a woman in the childbearing age group, either don't drink or have an effective form of contraception, and that's basically what should be the message to prevent this horrible disease if it goes in its full spectrum, and that's how you can prevent it.